are all things that could cause that alarm to go off. So what do you do about this? Well, as Jen has said a couple of times and will reinforce, always check your patient first. Put eyes on the patient, see if the patient is in distress, see if the patient needs perhaps manual ventilation before you start troubleshooting the situation. But I'm sorry. Can we go back one? I think we skipped a couple slides. That's one slide. There we go. So first off is the tube obstructed. The tubes are clear plastic, so we can see what's going on. Now sometimes the tube may need to be changed if the secretions or maybe blood is dried in the airway and you're unable to pass a suction catheter. One of the first things that I do in this situation is pass the suction catheter and make sure there's nothing obstructing that tube, because no other troubleshooting maneuver is going to work if you have a tube that just isn't patent. If the tube is okay, then check to see if the patient is coughing. You probably would have recognized that right away, though. If he is, suction the patient or do whatever you need to do to relieve that irritation so that the patient is more comfortable and the coughing subsides. Secondly, are there secretions in the airway? If so, obviously we will suction our patient. The next thing we'll do is determine if the patient is biting the endotracheal tube. Now, if the patient is biting with the front teeth, we can slip a bite block around the tube to protect it, a hard plastic bite block. There are also some less kind bite blocks out there that are placed between the back teeth to prevent the patient from actually closing his jaw. I don't necessarily recommend those.